The Kingdom of Eswatini proudly welcomes distinguished guests from across the African continent. From airports to royal hospitality, Africa unites for the third Kofi Annan Road Safety Awards, a bold step towards safer roads and sustainable transport solutions. Hosted in Ezulwini, this gathering reaffirms a shared commitment to saving lives through innovation, leadership, and partnership. Welcome to the 2025 Technical Workshop on Mobilizing Domestic Financing to Accelerate Road Safety in Africa, hosted by the United Nations Economic Commission for Africa, the Kofi Annan Foundation, and partners. Held on April 14 at the Happy Valley Hotel in Eswatini, this event brought together policymakers, experts, and stakeholders to address one of Africa's most pressing challenges, securing sustainable funding for safer roads. Let's take you through the day's key discussions and outcomes. The workshop began with a powerful opening session. His Excellency George Wachira, UN Resident Coordinator for Eswatini, set the stage by emphasizing the urgency of aligning road safety with national development goals.
Road safety remains a grave, and I repeat, a grave challenge, which could get worse as the continent is transformed to higher levels of prosperity and we put more vehicles on our roads. So we are here to remind ourselves that despite having just 3% of the world's vehicles, Africa accounts for nearly 19% of global road traffic deaths and has the highest road traffic fatality rate in the world at 19.4% per 100,000 population. We are here to say, really, this has to stop. We are committing ourselves to saying that we have to stop this.
Chief Ndlaluhlaza Ndwandwe, Eswatini's Minister of Public Works and Transport, stressed the need for political will and collaboration.
Your dedication towards road safety is encouraging, and we seek to ride on your zeal to garner strength to continue pursuing road safety goals for the betterment of Mswati and the greater Africa. The Kofi Annan Road Safety Awards are named after a very important personality in Africa, who has many accolades to his name, and the most important being a strong advocate for road safety at the highest office, that of the Secretary General in the United Nations.
His Excellency Antonio Pedro, Deputy Executive Secretary of the UNECA, highlighted the economic toll of road crashes, while His Excellency Jean Todt, the UN Secretary General Special Envoy for Road Safety, called for innovative financing mechanisms to save lives.
Road traffic crashes causes nearly 1.3 million preventable deaths and an estimated 50 million injuries annually, making them the primary cause of death among children and adolescents. Even though the number of road accidents in Africa is significantly higher than in other regions of the world, roads will remain by far the most popular mode of transportation for a long time in a context of a constantly growing population and economic activities requiring more travel.
The United Nations, under the visionary guidance of Kofi Annan, recognize the urgency of this challenge. And that is why we are working together under his name today. The Economic Commission for Africa has also played a key role in moving this effort forward. They have helped create ways to measure progress, review how countries are doing, and written an action plan to make roads safer in Africa.
Session 1, moderated by Robert Lisingi of the UNECA, tackled strategic considerations for financing road safety. Placid Baji outlined strategies to integrate road safety into national budgets, while representatives from Benin, Senegal, Uganda, and Eswatini shared country-specific insight.
We know that when we allocate funds and we do activities, we always focus on efficiency and cost control. So the fact that we consider road safety interventions as a cost is an obstacle because if we were to be challenged to say what is the cost of human life, we cannot come up with a distinct figure. So if you also look at it on the aspect of the people who are affected in terms of the victims, it affects people who are economically active, some who are still young, and we look forward to them leading certain sectors in the country. So if you look at the cost of those people who are dying on the roads, it's not actually something that we should be contending with. We need a deliberate discussion to say, how do we begin to include road safety as a development issue? I just want to make one small example that when we put up big projects, we have all the costs for that project. Should it be a shopping complex and so on? Inside the shopping complex, you will have facilities for cars to park, all other amenities for other people. But the people who come into the shop by foot, there is no provision for them for drop-off and pick-up by public transport. So you see that there is an issue of traffic impact assessment that should actually address those who are non-motorized accessing those spaces. And if they don't have that, you find that public transport will stop anywhere to drop them and pick them up. And then we say it's a road safety problem. But it has a bit of a developmental issue that we forgot to think about those walking into the shops.
Dr. Velepi Okelo from Eswatini's Ministry of Health underscored the link between road safety and public health, urging multi-sectoral investment.
As part of our strategy, the target of reducing by 50% the deaths that are due to road traffic accidents in the country. And so we align with that global target by 2030. And this is already included in our National Health Sector Strategic Plan and also in our National Non-Communicable Disease Strategy, which is also including injury prevention and control, as guided by WHO. So we are aware that a lot of what we see as the Ministry of Health is we are more on the receiving end. We are the ones who will receive the injured people, and we have to do something. So our target is mainly to ensure that we minimize disabilities and also minimize the deaths of the people who come into the facilities for services after the road traffic accident has happened. So in this, the Minister of Health cannot do it alone. So while we also prioritize through the NCD program, we prioritize injury prevention and control. This is where we are now entering the sphere of participating and as part of the multi-sectoral approach in ensuring that we also motivate for laws and policies that will prevent road traffic accidents. There are quite a number of them that have been highlighted.
The spotlight turned to the private sector. Moderator Vanessa Bolajul of Morocco's NASA led discussions on corporate responsibility and cutting-edge solutions. David Adongton from Ghana showcased public-private partnerships in action, while Philip Villiers of Sensei's Kato Group demonstrated how technology like AI-powered traffic systems can reduce fatalities. Mmiso Dlamini of Eswatini's FISA highlighted financial inclusion as a tool for grassroots road safety education. The message was clear: innovation and collaboration are catalysts for change.
What is loud and clear is that there is a business case to support road safety in terms of innovative ways to finance. The reason being that a significant number of days or hours are lost from people that are injured on the roads. And also there is a significant loss to government, as it has been mentioned that the loss is estimated between 2 to 3%. So in that way, it's an interest for both the private and also the public sector. The elements that are critical to facilitate that, first of all, is to ensure that we have sufficient data and research to enable both the public and the private sector to identify the specific elements in which they can collaborate. The second aspect, it's the issue of complementarities. We have the social security facilities which are supported by public sector, and we also have the public insurers. How do we then develop a mechanism so that the two are able to complement or support each other, so that at the end we can provide a full suit for those that are affected within the road safety space. The last one, program moderator, is to ensure that there is enhanced awareness, not about road safety as a significant part, more on the impact that are a result of the injuries that are caused on the road.
Session 3 featured candid experience sharing from across Africa. Nigeria's Federal Road Safety Corps shared lessons from enforcing stricter traffic laws, while Kenya's National Transport Authority discussed data-driven policy reforms. Cameroon and Ghana highlighted challenges in rural infrastructure. These stories reinforce a universal truth. Context-specific strategies are vital, but regional cooperation amplifies impact.
Refer you to an earlier discussion where one of us here, I think one of the delegates, suggested that if it is possible, they should make it in such a way that as you are entering the vehicle, the phone should stop. And that will account for a large percentage of safety. On the contrary, I disagree with it. The phone is an important safety component. Even in flights, there is communication. There is no way that you cannot use the phone. In Nigeria, for instance, about 5 months ago, we launched the mobile app, the FRSC mobile app. This is a device that can be used in your smartphone. And through that, your smartphone, you can get access to information about safety on the road. For instance, is there a crash ahead? Is there a traffic grid lock ahead? Is there a fire outbreak? Is there maybe weather change, and so on and so forth? And this can be used through, these smart phones, small devices. Now, when you now suggest that the phone should cease completely, how do you get this information? That is one. Then secondly, yes, we have more than 23 million registered vehicles in Nigeria, and enforcement is a little bit difficult. But I want to draw your attention to the fact that there is a clinical research that reveals that traffic behavior is a reflection, is an aggregate of how the people behave in their country. Simply put, if you come out from a plane, for instance, you're traveling from Eswatini to Addis Ababa or to Nigeria, and then you alight from the plane, you're going to a workshop like this, you enter a vehicle. Between the airport to this point where this discussion and deliberation is taking place, from the way and manner the drivers on the road are behaving, it will begin to give you a signal on how the people will behave, the people of Eswatini, the people, how they will behave when you go to.
The day's pinnacle was the launch of the ACOS guidelines on domestic financing for sustainable urban mobility, funded by the UN Road Safety Fund. Moderated by UN's Habitat Zodi Blabosh, panelists from Mozambique, Ethiopia, and Eswatini outlined how cities can secure funding for pedestrian-friendly infrastructure.
Then the critical role then that we play at local level would be one, you would assume that if it's a government mandate and a government competence and government sits in such gatherings and echoes the need to do it, you would assume that funds would then trickle and find their way down to local government. You will even assume that the wallets and the funds and the levies that come in from road accidents find their way to come back to local government. You would even assume that if you're in an urban space and you get a traffic fine, those funds would find their way back to the local authority. Maybe these are the questions and discussions we should be having, because in Eswatini, the trickle down is not there, but the mandate is strong. It sits at local government. So we maintain, we build, we finance, we run, we ensure safety measures around this infrastructure that we build. So really the first question would be then, how do we survive and how do we make it work in spite of the challenges that we face? And I'm imagining they possibly are similar in other African cities. So the first thing we do, we're very strong on collaboration, because honestly, we would not have the funds to maintain and sustain these. But the second point, when you speak about local authorities, if you don't talk about road safety and tied to urban planning and what tools we use to govern and manage development in the city, then there's a disconnect. So a lot of what we do has to do with how we actually plan our urban areas, because the solution for us starts with how you build the infrastructure. Because what we are finding is that we come post facto when we're now talking about how do we incorporate bicycles, how do we incorporate people living with disability, how do we incorporate, and all of this is a secondary thought. So the first thing to do, and we believe that from a funding perspective, it would be easier if at the actual development of these projects, we are asking the right questions. When you talk about road safety, many of us talk about cars and think about vehicles. But from an urban space, when we talk about it, we're talking about integration. So you want to talk about motorbikes. You want to talk about cycling, because we're moving towards that. You want to talk about pedestrians. So immediately when you think about developing that road, why aren't you thinking about it at that point? Because when you then come back and say to the city of Mbaban, put bicycle or cycling lanes, the question becomes, one, where, because the road reserve is small, but secondly, to come back and introduce that in an already built infrastructure is a different cost altogether. So the answer to your question is, one, delivering it right the first time, but secondly, collaboration. So sitting here, I'm very excited. I heard all the collaborating partners I need to now visit after this from an Eswatini perspective. But really the understanding is that if we look at it from a silo thinking and think that alone as local government we can deliver, then we'll have a challenge.
In closing, Robert Lisinge and Eswatini's Thulani Mkhaliphi summarized the day's resolve. Africa must take ownership of its road safety agenda. With 90% of global road deaths occurring in low-income countries, domestic financing isn't just a choice, it's a lifeline.